Hopefully you can hear me as
Yes.
people are joining today. Perfect. Thank you so much.
Nice.
Fantastic. Just some housekeeping here before we start. I was told recently that some people have had problem with the invite that I sent out. They didn't have the link. I don't know why. For some people it was there, for some other people wasn't. Hopefully everyone is going to make it. So 19 people. We will give them just 1 minute and we will start. This session is also going to be recorded. Okay, let's see on my screen. All right, so I'm so glad you're here with me right now. You are the kind of people that value air quality and health. And together, we are going to unveil some of the futures that are holding, GoAQS is holding, and also some very inspiring talks by our members. So I would like to begin telling you a little bit about the agenda today, which is a general overview, a year in review, what we have done so far. We are going to talk a little bit about the white paper, our next steps, and finally, we will have the key messages from our members. At the end, if time allows us, we will have some Q&A, and you are always welcome to comment on during the webinar. Some members will try to answer. If we cannot answer live, we will reply to you later on. So far we have 170 people from 34 countries, 52 academics and 118 experts, and those are the regions that currently support GoAQS. We are hoping that we can reach even more regions, especially in Africa and South America, and hopefully also in the Middle East. This is the website readership so far for the year of 2025. You will see that United States actually is the first country that's visiting our standard, GoAQS. Then go Spain, but forget about Spain. This is because 98% of the traffic is coming from me, as I daily go there and check the website and in order to make sure that everything works perfectly. Then we have United Kingdom, Netherlands, and Germany, some of the top countries that they visit us throughout the year. As you know, we have different working groups for the different pollutants that we explore inside the standard, and these areas of interest start from the particulate with 72 people and end up with bioresols and mold, which are two new working groups. I'm gonna share more details later on about those two new groups as we are going to start working with those two pollutants later in 2026. What it strikes my attention about this graph is that particulate matter always get the attention of everyone, but for some reason people neglect some of the other pollutants in the indoor space like radon. But at the same time, they also think that ventilation is as important as particulates. Here are some of our partners from the industry and also some other nonprofits that we are collaborating. And we are very thankful for their collaboration and embracement of GoAQS. So far, GoAQS has been in many places, from Thailand to the UK to the United States and many other places where I'm not able to go, but thanks to the community that we have built, we have people supporting and talking about GoAQS wherever they are, like Professor Juliana Jara-Ludin, Professor Prasant Kumar, Professor Christos Agiropoulos, Francesca Brady, Todd Boss, Professor Browning King, Dr. Georgia Laudas, the EDIAKI cluster, the IDEA cluster, and all of those organizations that they work with us in establishing and communicating with the world what we are trying to do around indoor air quality. So as you know, since November, we have the white paper version 1, which you can download from our website. Here also is a QR code if you like to scan it. And there you will find some of the main pillars of GoAQS, which are the air quality limits. Those limits are specifically tailored for people all around the globe. You know, we have 2 tiers, the starter and ultimate. We have 2 tiers because we don't want to exclude people from areas where, for socioeconomical reasons, or maybe technology is not available or reason to start looking into the matter. Then we have developed the indoor air quality score, which basically is an index that helps all people all around the world understand with the same metrics what's happening with the indoor air quality. And finally, we have indoor air quality policies, as we believe is very important to give some steps to the policymakers out there, or schools, or even other buildings that they would like to implement air quality indoors, and they do not know where to start. So as you know, we have the starter tier of our limits. Here, we propose limits that they are more relaxed in order to eliminate any barrier of entrance. And then we have the ultimate version where it's based on health outcomes from the different pollutants. And we have the most strict values that we will be able to find from the literature out there. The score, once more, is there to facilitate understanding of what's happening in the indoor space. And we have only 3 tiers to make things easier for everybody. Again, blue, we have chosen the color blue because we believe it represents better the state of indoor air. It also represents what's happening outside as well. The sky is blue. It also helps individuals with color blindness understand what's happening and differentiate the different tiers. With the help of a great engineer, Bogdan, we were able to create a code example and a repository on GitHub where you can go and find some code. This is an example code. This is not the complete package, let's say, of how the index works, but it is an example to help companies or individual DIY projects implement the same logic into their devices. Now, regarding the next steps, we are trying to future-proofing GoAQS. I'm going to talk about this later. We are also writing a peer review paper about GoAQS. We are going to discuss the working groups about mold, ultrafines, and bioaerosols. And also, we are going to propose some research projects that we would like to explore in 2026. So, in order to future-proofing GoAQS, we need to raise some kind of funds. In order to do that, we have to incorporate some kind of a legal entity. And we decided to go with a CIC. CIC means Community Interest Company, and we're going to establish it in the UK as a non-for-profit company. The main reason we decided to go with that also was that it's easier. It's less complicated to go through the legal process of establishing an entity. We are going to expand the management team. So far, I am the person that does everything, but help is on the way, and I'm looking forward. And then we are going to rename some of the groups that we already have to the main committee, the technical group, and also the community members. We will also send out some friendly pro bono agreements in order to be more transparent and what we are expecting from you. And finally, we are trying to find some fundings from the EU and UK in order to support all of those ideas and projects that we have in mind for the future. So as I said, GoAQS, with the help of 17 other experts out there, we are writing a peer review paper. Hopefully, it's going to be published soon. I have already sent it to the members in order to review it, add comments, or what it's missing. And you will be informed once it is published and once it is available for everyone to download it. Basically, there we give more details about Go AQS, why we decided to take different approach, and we based everything on scientific evidence. So we also have cited many literature as well. The new working groups starting 2026 are going to focus on those three pollutants. The submicron and ultrafine particles is going to be embedded inside the particle working group with the 72 people that we previously saw. And we are going to start accumulating information about what the researching is telling us. Is there any number around ultrafines and submicron particles that we can recommend apart from WHO? Maybe some newer research is on the horizon. So let us know. We will we will inform you very soon about the call. No need to do something right now. The working group for mold is going to start in February. Again, same procedure. We're going to ask you about research findings, and we are also going to find limits from around the globe because they are already some, for example, from Malaysia. And finally, in March, we will initiate the bioaerosol working group. And again, the same procedure. Now, regarding the research proposal that I have told you, the first one is about how can we use all of those low-cost monitors that we have in the indoor space, enrich basically epidemiological studies. So we have designed already and we have written a proposal. I will communicate more details after the call. For those that they are interested, please reach out to us by email. Basically, what we are going to do is see how accurate those monitors are, low-cost monitors, and how those kind of data compare to an outdoor reference station, which is the most common way right now we use for epidemiological studies on different pollutants, and see if we can incorporate this kind of information from the low-cost sensors into the epidemiological studies. So I have now created a Slido where I would like you to scan the code or use the number that appears on your screen and let us know, like in 30 seconds, on whether you have found something similar, any similar research on this specific project that we are proposing, in order to make sure that we are not making a duplicate study, right? So if you do not know, just say you do not know, and that will help us, continue with this proposal. Just scan the QR code with your phone, and immediately you can vote on what you know. So there is one person says yes, or maybe two. So for those that they say yes, please send us this paper. We would like to review it. You have already our email address. So please, 8 people so far have said that. 9. Most of them, they do not know. The majority says no, and then a few yes. All right, and I'm gonna move to the next one. You can continue voting here. And again, I ask you, if you know those papers, just please send us to us. Now, then the following proposal is about what will happen in the indoor space if we remove particles, and we are able to remove particles and measure them in a particle count number for different sizes from 0.3 to 5 microns. According to the ISO class clean room certificates, there are different classes of rooms, and they are able to remove most of the particles. In this case, if we remove those particles from the air, including bioaerosols, right, are we able to recommend a higher CO2 level? And we are asking this number because as, for example, the European Union investigates and proposes that we have to make, building more energy efficient and optimize decarbonization and all of those things, it is very interesting to us to see if maybe this is the avenue of allowing higher CO2 levels by decreasing the amount of pollutants based, for example, of the ISO standard. And again, I have created a Slido. Please again scan the QR code and answer the same thing. If you are aware or know of a study that has explored this research project. Once more, if you have more information, please send this kind of information to us. So the majority says that they do not know, they're not aware of any study, which is encouraging, but let's see those that they are aware as well. Okay, and you can continue voting. There is no problem there. And now we will begin with a message from each and every member that has supported us so far. And I would like to begin with Professor Pavel Werkoki, and I'm so sorry about the pronunciation here. He is from the Department of Environmental and Resources and Engineering in Denmark. And today he's going to speak about standard metrics for monitoring the EPBB and health. So without any further ado, please, Professor Powell, you can turn on your microphone and share with us your input.
Right. Hello, everyone. From Denmark. It's a little bit gray. And unlike winter, so this is not very good condition, actually. Thank you very much for giving me opportunity of giving a few messages today. I actually prepared a slide to follow that, so it'd be much easier probably. But can I share my? Okay, I can do that here.
Yes, you can.
So, why do this? Yeah. So, I have many screens, so you probably can see my screen now. I have many screens, so it's rather difficult for me to put it in the presentation form. I hope you can see it properly.
Yes, we can.
So, I created a list of the challenges and opportunities that I would like to say a few words about to increase IQ awareness and the next steps that are very important for the success of any actions that are related to indoor air quality and improving indoor air quality in buildings. I've been thinking about it for years, and I have been in indoor air quality research for the last 30 years, and through the research, I was hoping that we can provide sufficient arguments, but those arguments were not sufficient, actually. And then I started to think about what other reasons are that the indoor air quality is not in the, does not have the that important place in our life as maybe other aspects. So I created a list of, which I called necessary steps, and I call it the Great Nine. And these are the 9 aspects that I will briefly say about, and then put it in the context of what is happening in Europe. So I think the first important step is to have the IQ metric. And this is what Sotios is doing here, but I think it is absolutely necessary that we have an IQ metric that provides information about the quality of indoor air quality, the quality of indoor air in buildings. Today, basically, we are acting on some maybe not complete information in buildings and take decisions without knowing actually what has to be done. in buildings. So that metric will help us to compare the buildings, benchmark the buildings, and make the right decision, but also will increase the awareness of what are the conditions in the buildings. I think we should also, with that metric, think outside the traditional way of thinking about the metric. So with the development of the wearable instrumentation, we could also think about the metric that does not only include the objective measurements, but also health measurements for every person. I think the second part that is important is actually avoiding bubble effect. So for any discipline, including and building stakeholder, today most of the discussion occur actually within the discipline. So architects to talk to architects, and medical doctors to medical doctors, and engineers to engineers. I think we see that bubble effect, which is actually causing that there is a misunderstanding of the needs and actually also misinterpretation of certain actions. So this is the second step that I believe is extremely important, that we need to speak across those different disciplines. The third step is considering IAQ as a public health issue. I'm not sure whether this is sufficiently considered. So if we don't have that consideration, it's rather difficult to convince that IAQ is that important. One of the problems that we experience today with IAQ is that it refers to comfort, which is the reason is the WHO definition of health and interpretation of WHO interpretation of health. So I think considering IAQ as a public health issue will also help increase the awareness. The first point is we have enough arguments, but it seems they are not sufficiently strong with respect to some of the aspects. For example, it is really necessary to convince that IAQ does not only require increased cost and increased energy, but IAQ actually can support decarbonization. How? If we can provide the information that IAQ is actually improving health conditions of people, then we can reduce the carbon footprint of the healthcare because people will actually use less of the healthcare services. Healthcare services actually are responsible for up to 5% of all global CO2 emissions. So I think there is a lot to be shown there. The fifth point is a narrative change. I think IAQ has been presented in form of a risk and danger rather than as providing a positive emotion of vibes. So if we talk about IAQ as improving our living standard and conditions, in a sense, not in a sense that it actually in a similar way as if we eat healthy food or drink water, clean water, or maybe other actions that we make. So then probably there will be more interest in the IAQ. This is called salutogenic design, and there are aspects of IEQ that are indoor environmental quality that talk about salutogenic design, but not with respect to indoor quality. In order to be successful, the sixth point is we need to have an affordable IEQ solutions, meeting requirements for all. So there are 2 points. One is that IEQ, again, has been considered as costly affair. So we need to have a solutions that anyone can afford. Today we have a great projects, but they cost a lot of money. So we need to have projects which actually can be affordable for everyone, and those solutions should not only look at the average person, but also specific individuals, because there could be different requirements for different people. In 7 point, I think the education is extremely important. And I think that goes with the issue of IAQ as a public health issue, in which basically engineers should be taught about the some health aspects, and medical doctors should be actually taught about the importance of IAQ in basically public health. Today, when we go to our general practitioner, he or she will never ask us about the conditions in our home. They will ask us about what we eat, what we do, and so on, but I mean, not about the indoor air quality in our homes. So I think so this is very important that this part is also included. I'll be finishing soon. So then once we have that aspects considered, we need to consider in buildings additional features, which are preparing the buildings for unexpected events such as overheating, wildfires, infection control. I believe the infection control should become a standard actually in all the buildings. And the 9th point is considering IAQ as a commodity, in a sense, putting the value of the IAQ, I mean, the price for 1 cubic meter of clean air. Not that everyone should pay. I mean, we pay now for clean water and energy, so we can also pay for the clean IAQ if it is provided, but also in order to provide information on how much savings we can have by basically providing the clean indoor air. In Europe, the Energy Performance of Buildings Directive creates an excellent opportunity for providing some of those aspects, especially IAQ metric, because for the first time, the energy and indoor air quality is treated on a par, meaning that on the same level. So the buildings that undergo energy retrofits or will undergo in the future, they need to not only reduce the energy, but also secure the indoor air quality. So this is my my short message to you, how I see this, the challenges for the future. Thank you for your attention.
Thank you so much, Pavel. I think every and single individual point there, it resonates inside us, all of us. I would like now to continue with the next speaker, Professor Juliana Jalaluddin. She's a professor at the University of Putra in Malaysia. And today she's going to speak about the global standards, local impact, and changing indoor air quality in Malaysian schools.
Hello, everyone. Good morning, and thank you, Sotirius, founder of Go AQS, for giving me the opportunity to speak on the topic that is very close to my work and passion, indoor environmental quality in Malaysian school. I didn't prepare any slide because Sotirius didn't allow me to do. Okay. So clean air is a fundamental right for children with growing lungs and developing bodies. Breathing in polluted air can cause long-term harm. So air quality in Malaysia, both outdoor and indoor, have been affected by rapid urbanization, posing serious health risks, especially for children. So studies have documented a strong link between air pollution, exposure, and adverse health effect in Malaysian children. So Malaysia faces a dual pollution challenge, both outdoor and indoor. So outdoor from traffic emission, industrial activities, open burning, and recurring transboundary heats often elevate fine particulate matter levels beyond the World Health Organization recommended limit. So with this impact being most pronounced in urban center and throughout the dry season, so indoor, the problem are different, but no less harmful. More dust, chemical pollutants, and poor ventilation contribute to unhealthy environment, especially in school. Children environmental health is a top priority under Malaysia National Environmental Health Action Plan, known officially as NEHAP. So in Malaysia, children spend most of their time indoor classroom and other educational spaces, yet indoor activity often receive less attention. So recognizing this, Malaysia National Environmental Health Action Plan has developed an indoor environmental quality action plan led by environmental health expert. So this plan provides clear guidance on monitoring indoor air, controlling pollutants like mold, dust, and volatile organic compounds, and improving ventilation to create safer, healthier learning environment. So global standard local impact emphasize aligning Malaysia school with international guideline, with WHO, ASHRI, and also Go AQS. In Malaysia's tropical climate, school face challenges such as high humidity, poor ventilation, mold growth, and exposure to outdoor pollutants like PM 2.5 and also haze. So to protect children, so our most sensitive population in Malaysia, we need IEQ or IEQ standards specifically tailored for educational setting, aligned with global best practice, yet adapted for local, climatic, cultural, and also infrastructural realities. So adapting global standard locally help to reduce children exposure to pollutant and also can improve concentration and academic outcome, promote resilient and sustainable school environment. So the IAQ action plan translate science into solution and also can adopt immediately and link local policies to global AQS principle, combining monitoring, education, and also mitigation strategies. Global AQS and local action creates a cycle of healthier indoor environment. So global science inform local solution and local experiences enrich global knowledge. So the evidence is clear, the solution are within reach, and the benefit are immersed. So let us join hands, scientists, policymakers, communities, and citizens to ensure that future generation can breathe clean air, safe air. Thank you, everyone.
Thank you so much, Professor Juliana. I think it is very important to have representatives from different places of the world. In Asia, I think you have done a fantastic work so far. So I really appreciate your speech today. Next, I would like to present my dear Professor Bronwyn King from the University of Melbourne, Australia. Professor Bronwyn will talk about the Global Pledge for Health on Indoor Air, from concept to launch and beyond. The floor is yours.
Thank you very much, Sotirios, and I'm very happy to see there are two Sotirioses on this call. That's one of my favourite moments of the year, was to introduce you both, and so it's lovely to see so many friends lined up in the attendees today. I know I've only got just a moment, but just to introduce myself in case I haven't met some of you. I'm a radiation oncologist by background, but I've been working in health advocacy for about 15 years, mainly in tobacco control. And it's the COVID pandemic that really brought me into indoor air quality. I wish I had have been in a bit earlier, because it turns out it really is a topic that means a great deal to me, and I'm very committed to seeing change. For about the past 4 years, I've been doing advocacy in Australia, reaching our government leaders and other leaders to ask them to act on indoor air quality. And then this spilled over to global connections that I had pre-existing because of my other work in tobacco control. And it was about 1 year ago, I met Georgia Lagudis and M. Pang, both from the United States. I was super impressed with both of them. And they mentioned that they were working with Montenegro to help an uplift in indoor air quality. And they mentioned in passing that the president and the Prime Minister of Montenegro were really keen on indoor air quality. And that really got my mind ticking over, because previously with my tobacco control work, I had been lucky enough to host an event at the UN during the UN General Assembly in New York. And for 4 years, I had been thinking, we really need to have an event on indoor air quality at the UN. And it's very hard to do it, but the first step is to find a prime minister or president who would like to support the event. And as soon as I heard about the Montenegrins, I thought, let's see if we can make this happen. So to cut a very long story short, we managed to pull it together. We were very pleased to be supported by almost 80 academic institutions from around the world, including the Australian Academy of Science, Burnett Institute, Brown University School of Public Health, and Oslov Project. But we had many others from around the world. And in September, for those of you who are lucky enough to be there, we brought this, really, it was an incredible event where we brought together indoor air quality advocates and leaders from all over the world. And it was just an amazing moment to bring everybody together. I think I've just never felt such a sense of solidarity with finding all of these new friends and colleagues from every part of the world. And I think up until that moment, many of us had felt a bit alone and felt like the challenges were only ours. But it was enormously helpful to hear some really inspiring stories and to share some of those challenges and frustrations. And I feel so much stronger after that event. I feel like together we're so much more powerful. At that event, we decided to launch the Global Pledge for Healthy Indoor Air. And when we wrote that, we really wanted to point out 6 pillars or 6 reasons why governments should be prioritising indoor air quality. And of course, the people on this group know what they are, but many people don't, and they haven't yet prioritised this issue. So we talked about the human right to healthy indoor air, the importance of healthy indoor air for health in the short term and the long term, pandemic preparedness, climate resilience, safe work, and accessibility and care for all. And as you can imagine, I think just each one of those is enough to make governments act. But collectively, it really does show why it's urgent. And this is an issue that should be right at the top of the priority list, certainly for health ministers and safe work ministers, climate ministers all around the world. We were very pleased that Montenegro and France were the first 2 countries to sign that global pledge. And as of today, we also have 235 aligned organisations from around the world that have signed up. They're academic institutions, schools, advocacy groups, community groups, they're universities and aligned businesses. So if you're out there, a represented organisation that hasn't yet signed the Global Pledge, please do go ahead and be part of the movement. And also at the event at the UN with Georgia and MPANG, together we launched Air Club, which is a community of individuals who are working in the space of improving indoor air quality. Everybody is welcome to join. Just go to airclub.org. And the great news is you get a really cool little badge. This is a canary. This canary is named Monty in honor of Montenegro's leadership in this space. And it's a badge that everyone can wear proudly that shows that we're all in this journey together. So thank you for having me today, Sotirios, and cheers to you and your team for such excellent work. And we can't wait to work together with you again in 2026.
Thank you so much. And everything happens because you and all of the other experts are part of Go AQS. Next, I would like to invite Dr. Yad Altar to speak a little bit about optimal air quality, leading the change for sustainable change. Dr. Yad is coming from Kuwait. He is a reference in filtration, and I look forward to hear his talk today. So the floor is yours.
Thank you, Sartorius, and good morning and afternoon, wherever you are. Evening, I guess, for some of you. It's good to be here, and it's good to share my 2 cents about a field that I've spent nearly 27 years. I have a message that has 4 platforms, but before I start sending the message, around 2014, 92% of the global population was exposed to poor air quality. We pledged to work hard and change the status quo. Today, it's 99%. So one thing I wanted to also highlight is, are we on the right trajectory here? And what I'm proposing today is a very simple plan of 4 steps. The first step to ascend the heights of the air quality and reconfigure the air quality quest is the monitoring part, which I'm sure we've talked about it extensively. But the holistic monitoring will have to take place, in my judgment, on 4 counts. 1 is outdoor, indoor, second is indoor, third is personal air quality within our own bubble, and the 4th is correlating all of these data to air filter performance, so we know what we're getting out of that supply air in an HVAC system. Once we get this homework done, and knowing that at least filters are not off-gassing, or they're not degrading air quality, or not releasing particles that were previously captured, we can then start to set forth in a very expressive terms what we're getting from the supply air. And then also the personal exposure part will help us know if a specific individual or a human occupant within a building envelope is actually degrading air quality. The second part is the dynamic response systems of HVAC systems and filtration systems. And note here, I'm saying filtration systems, I'm not saying air filters, because I think this is what's ailing the air quality from a filtration perspective. We cannot rely on air filters to be encompassed in a HVAC system. Filtration systems or air filters would have to be in their own filtration systems, communicating their performance not only to the HVAC system and kind of air quality systems that we have, but also we have to have some sort of a performance integration. Once this is done, we're going to go to the next level, is how are these systems, quote, HVAC and filtration systems, are going to respond to the following. 1, variation in indoor air quality. 2, variation in human occupancy in case an emission or internal pollution has happened within the human occupancy area. So any fluctuation in human occupancy, an additional human occupancy would have to, be reflected upon not only air quality, but how fast I'm going to respond as an HVAC and filtration system. And the third part is, what is this building envelope made for? Is it a gymnasium? Is it school? Is proximity between two individuals is an issue? These are, we got to know this, because if we want to get things done, we want to have to, get different outcomes. We're going to have to change the dynamics here. So once we know all this information, we'll be able to better predict and hence act immediately through our responsive systems that can realign and reconfigure the air quality. The third part of this is the data-driven governance. And to do that, we would have to provide air quality data, if it's school, to the Ministry of Education, so that we know what kind of air quality our kids are exposed to, and how are these schools and the facility management have got in line for them to protect them. How fast can you actually respond to wildfires, sandstorms, any sort of contamination outdoors and indoors? Once we get the governance part, we have to promise ourselves that we're all on the same air quality page, speaking the public health and well-being language. We have to allow public health and well-being to drive. For 50 years, we allowed energy efficiency to drive, and we ended up potentially with a pandemic. Let's have another 10 or 20 years allowing public health and well-being with energy efficiency in mind, and then I'm sure we're going to have different results. My last part is correlating, and that's the fourth part, correlating air quality and public health and well-being data. We have to do that because this is how we assess our success. Now we lack that precision. We need to understand that what we have been doing actually impacted lives and hence enhanced them. And the last message is, since clean and fresh air and all these promises are of a tremendous interest, we need to have a universal definition of what we really mean clean air before we actually deliver it. Stories, back to you.
I loved your sentence about let's allow air quality to be the first for 10 years, and let's see if it's going to outperform every other metric that we have had so far inside buildings, like energy. Thank you so much. Next, I would like to introduce you to Nathan Wood. Nathan is, I think you know him, he's expert about ventilation strategies. And again, he's coming from the UK. And nothing else. He's a reference in the ventilation space. So Nathan, the floor is yours.
Thank you, Sirius. Pleasure to be here. Lovely to meet you all. I'm here in the UK and I've been working in the ventilation industry for nearly 24 years, and gosh, 10, 11 of those years have been concentrating on indoor air quality. I've met many of you online. Many of you have been very, very helpful and supportive over the years. So thank you for everybody on the call that I may have bothered over the time for your expertise. Pavel, I just got to touch on our IKEA idea that we've discussed many times, where people don't buy furniture, they buy a lifestyle, and part of that lifestyle should include good indoor air quality as a standard. Unfortunately, the real impacts that we see with our boots on the ground with our engineers paints a completely different picture to what we see in industry and in regulation. And a lot of the strategies that drive the decisions in new builds, in retrofits, in schools, homes, offices, is all about the minimum guidance that's set, the minimum requirements. So building regulations set the minimum codes. We build to those minimum codes. Nobody actually takes into account what strategies might need to be adopted to ensure that the health and well-being of the occupants inside these homes. So whilst regulation is important, it's the health outcomes that I think that need to come first. We need to change that mindset of how we actually look at spaces and the people that exist within them. Because ventilation is probably one of the most cost-effective health interventions that we can do. And as ventilation engineers, we have more of an impact on people's health than their own doctor. So whilst we might be tweaking a fan in a cupboard or up on a roof space or in a basement, everything that we do has an outcome to, it could be one person, it could be a whole office, it could be a hospital. So we need to take an understanding as the professionals of what we do can have a positive or negative impact. So if a system isn't working correctly and we think, oh, I'll finish that off tomorrow, that night, that period of time, you know, it could have unknown effects to the people within that space. So whilst we're looking at the way in which we need to look at the strategies and health outcomes, we need to ensure that the competence and the compliance of the people working on these systems aligns with that as well. So there's a huge amount that I think needs to be done, mainly in the UK where my focus is, around ensuring that the training and the competence for people working on ventilation systems aligns with the health outcomes, and bringing all of these pieces together. So from academia to manufacturers, boots on the ground, apprenticeships, you know, apprenticeships, we should be bringing in the next generation of building physicians. It's not just about having your electrical competence, mechanical competence. It's about enabling people to have an impact on other people's health outcomes. So by collaborating with AQS, and I'm involved in World Ventilate Day, thank you for everybody's support with that over the years as well. It's really bringing together this global movement that is changing the direction of buildings and the way that we treat buildings, because our governments can talk about protecting our environment. I think it's up to us to look at how we handle our indoor environments. Whilst outdoor air quality is pretty much out of our control, indoor air quality is to a certain aspect, especially your own home, a place that you are under direct control of. And I think there's been a real change and a real shift since COVID with the deployment of cheaper, low-cost air quality monitors. Most spaces now have some form of air quality monitoring. In the last 2 days, I was visiting a manufacturer that's looking at the deployment of air quality sensors in social housing, mainly focused around damp and mold. And we've gone on some training courses to upskill our teams to have more of an awareness around that. So it's just about bringing everybody together, all of these specialist niche subjects. I mean, mold is a complete game changer for us as how we look into that as well, the chemistry and the science around indoor air quality. But it is going to breed a whole new sector. And I think we're just starting to see that change happen. I'm out of time, so I'll just finish off by just saying thank you everybody for all of your input. Hopefully one day I will get to meet you all in person, but for now, thank you very much, Saturius. Back to you.
Fantastic. I really like the no more minimum standards, and we can control the indoor space. So let's control it. Next, I would like to invite Assistant Professor Yorgos Panaras from Greece, from the Aristotle University of Thessaloniki. He's going to talk about a project that I'm collaborating as well. It's called Net for Clean Air Knowledge Hub. We are actually developing a digital platform for air cleaning technologies, air purifiers. Yorgo, the floor is
Yes, Sotiris, thank you very much. I'm honored to be included today, and of course, in this session, and of course, we have a long-lasting collaboration, and that you are a part also of this project. I'm going to talk about two things. The one thing is that exceeds perhaps the project is the overall picture. Well, I'm strongly involved on ventilation aspects, trying to cope with the indoor environmental quality and energy requirements. I think this is a big challenge for me, as I'm a mechanical engineer, and I have moved to the indoor environment, let's say, field also. I'm more specialized on mechanical engineering systems, HVAC systems, but throughout my research work, I have been familiar also with indoor environmental quality, mainly focusing on thermal and indoor air quality. So for me, just to put the challenge is to bridge the gap, or to try to combine the requirements of indoor environment with the energy requirements. These are two very, let's say, the ambition is high. As said before, the EPBD provides a very good platform for doing this. But of course, the research challenges are very high, and we talk about monitoring. The colleague before me talked about low-cost sensors. So we have, on one hand, we have the monitoring. We have the AI opportunities in controlling aspects, self-learning, self-validated, whatever, in order to do the proper regulation in terms of controlling. We need very good simulation tools, and this is also a challenge. These simulation tools have to be able to collaborate with local controllers or central controllers. That's also a discussion. But machine learning helps us with surrogate modeling on these issues. Of course, when we talk about the general public and we talk about the certificates, it's not only very dedicated or very, let's say, it's not only the energy systems, but we have to talk about the public, we have to talk about building certificates, and this is also a challenge to put ventilation, indoor environmental quality strongly into these certificates. And that's a challenge for Greece also, because we have the adoption of EPBD, and it's something that it goes on, but the discussion is very wide, because as engineers, what we need to do, we try to compromise the cost with the accuracy, and that is a very difficult balance, especially when we talk about the complete building capacity of the country or of Europe, etc. So we have a huge amount of buildings that we have to cope with when we talk about certificates. So I think Go AQS, for me, it's a very interesting place. It's a very interesting initiative where I can share these thoughts as today. And I also took the opportunity, and I wanted also to promote, to find the opportunity to promote a project that is related to what I said before in terms of air cleaning. It's the project is net. I will just I will tell you, it's the Network for Indoor Air Cleaning. It's a cost action, or Net for Clean Air, and it aims to create an international and interdisciplinary network of diverse stakeholders with a shared vision of promoting clean air for healthy and energy efficient indoor environments throughout Europe. There are a lot of activities going there. I will provide you the link of the action. I think, Sotirios, I can put it on chat. I can put it on
Yes.
chat right after I finish talking. And of course, just to inform you that within this action, the results have not been officially published or validated yet, but we are working on the first part of the action with reviewing the relevant literature and market industry databases in order to collect the relevant information for air cleaners, and of course to identify existing technologies, commercially available solutions for indoor air cleaning. So there, I invite you also to find the relevant material, and of course I would be happy to communicate with you and provide you any other data. And of course, it's an action that I find fits very well with the scope of Go AQS, because also air cleaners, okay, they cannot, of course, replace ventilation, but they can also be a part of the solution. So that's all for me. I'm just putting now, I have to find the chat, but
Thank you, Yorgos.
yes, thank you very
yes,
much. I will
it is very
yes.
Thank you so much. It was very important to hear someone from the engineering aspect and understand that there are challenges when we are talking about standards, and hearing your input about, we are trying constantly to compromise on one thing in order to achieve another thing. Maybe we have to sit down and figure out, the bridge between those two different things, which is energy and air quality, and how we can bring them together. So thank you so much. Next, we have Dr. Maria Figols. She is the Chief Science Officer from Imbiot, one of the companies that support Go AQS from Spain. She's going to talk about raw data to indoor air quality sites and how they are planning to integrate Go AQS with their products. Maria, the floor is yours.
Yes, thank you very much, Sotirios and whole Go AQS team for letting me take part in this interesting panel. Yeah, as you said, I'm the Chief Scientific Officer at Imbiot, which is an indoor quality monitoring manufacturer. However, I come from an architecture background, so my approach, my personal approach to indoor air quality has always been very pragmatic and very human-centered. Really trying to understand this relationship between the built environment and the people who occupy it. So because of this background, I've become a bit obsessed with turning data into meaningful insight. We actually collect so much information, but what really matters at the end is whether this information is going to help us understand exposure, to make decisions, and mainly to improve people's health and comfort. And that is really the point of my contribution today here in this panel, and how we see how Go AQS guidelines and score can be integrated into a continuous monitoring solution like the one we are working to not only show information, but of course to support actionable decision making. And maybe the first thing to highlight is that continuous monitoring is fundamental requirement to effectively apply a health-based standard such as Go AQS. So we've been few of the conversations has pointed out low-cost monitoring and continuous monitoring as one of the key actors in this whole debate about indoor air quality. And the white paper makes this very clear. Real-time continuous measurements of key pollutants are key to ensure transparency and a true understanding of exposure conditions, especially in spaces that are not continuously occupied, like maybe schools or offices. So in this sense, spot measurements on one-time measurements, just long-term averages miss short-term peaks, and those peaks can be I'm not going to be strictly, but can be part of where the health risk appear. So this continuous data is really the background that is going to allow us here and allow the AQS scoring methodology to work as intended. And that's the way we say it, having all this data and being able to actually turning into inputs that we can actually act to improve this, improving the quality. So from here, what we are doing is looking at how to technically integrate GoAQS into our indoor quality data platform, so that real time with multiple pollutant sensors can be integrated or can be translated, more than integrated, into a standardized and interpretable indicator. And this means that instead of presenting just the metrics of single parameters, CO2 on one side, PM on another, we can provide a unified health-oriented score that actually reflects the exposure in real time. So once we have a continuous GoAQS-based interpretation in our platform, it becomes possible to support real-time health-driven decision-making. You've been talking here about ventilation and filters and controlling in a more efficient way the building, and that comes from having the information and continuous information, and being able to have a real-time data can support the integration to HVAC systems or building management systems that are going to allow the automatic ventilation filtration adjustments. And this is how we see this scalable data-driven control of indoor environments. So to summarize, how we see the integration of GoAQS into a monitoring solution, in our case based on low-cost monitors, and a dedicated indoor quality platform, is not only about displaying an index or a score, it's about creating a full chain from continuous monitoring, from continuous sensing to health-based interpretation. And that takes us to automated action. And that is what takes GoAQS framework into real operational buildings. So as Professor Juliana said, it's a combination of monitoring, education, and mitigation, and that's the reason of supporting GoAQS or joining R&D projects like the K-Health scenario that will be presented, I think, in this afternoon session. So thank you very much for allowing us that time, and really thankful to be listening to our inputs.
Thank you, Maria. And yes, inside GoAQS white paper, you can also find good practices where we say explicitly that we believe in continuous monitoring with any product out there, because this is the way to go, and also in order to reduce this energy demand from the ventilation systems. Last but not least, and I'm sorry I wasn't able to complete the slide, but Professor Sotirios Vardoulakis from Australia, from Canberra University, he informed me 5 minutes before the meeting, before the webinar, and apologized because he was down with the flu, but he was able to make the webinar today, and we would like to have you, Professor Sotirios, and hear you today on this webinar. So please, the floor is yours.
Thank you so much, Sotirios. So I'm the other Sotirios here on the line today, and I'm very grateful to Bronwyn for the introduction. So we're both Sotirios and I are from Greece, but we live in different parts of the world. So I'm in Australia, in Canberra, at the University of Canberra. I'm Professor of Environmental Public Health and the Director of the Health Environments and Lives Network, the HEAL Network, which does a lot of work on air pollution, indoor and outdoor, and climate change adaptation, mitigation in urban environments, and more broadly. Our focus is on health. I would like to remind ourselves that indoor air quality is a very important issue, especially in low-income countries. We know that around 3 to 4 million people die every year because of poor indoor air quality, and this is mainly in low-income settings where people use burn solid fuels for cooking and heating. So Of course, indoor air quality is an issue in high-income countries as well. But we should not forget that in other settings where ventilation or filtration is non-existent, air pollution, indoor air pollution is a major issue for public health. We are doing a lot of work on indoor air quality. Here in Australia, awareness has increased very significantly since the COVID pandemic, but also since the bushfires we had here. A few years ago, we had catastrophic bushfires. There was a lot of smoke in the atmosphere for prolonged periods of time that raised awareness around air pollution. People started using masks and portable air cleaners in their houses. So and after that, of course, we had the pandemic. So there is much more awareness, and also there is technology development in this space. And currently, we're using extensively local sensors to monitor air quality. And we also use and test different types of air purifiers, and inclusive some air purifiers, DIY air purifiers that we're testing and promoting in low-income settings in Asia. I would like to make I'm the last speaker, so I won't take very long, but I would like to make a point about climate change, because I think this is quite important. What is likely to happen in the future is that we're going to have much more smoke in the environment from wildfires, bushfires, as we call them here in Australia. And this will have an impact on outdoor air quality and indoor air quality as well. Also, in the context of climate change mitigation, we need to make houses and buildings more energy efficient. That means more airtight. This may decrease the ingress of outdoor air pollution to the indoor environment, but whatever is generated in terms of pollution in the indoor environment will have much more impact on indoor air quality and on human health. So we need to make sure that we build tight, but we also ventilate right, and we also filtrate right to protect human health in the built environment, and that is in households, in the school environment, in offices, and other workplaces. And I would like to congratulate Sotirios. I think this initiative is extraordinary. It's very timely, and we are very supportive of your initiative, Sotirios. And I would like to thank all colleagues for their contributions. And I think there is a lot of mileage and a lot of momentum, especially after the meeting Bronwyn mentioned in New York, and some other flagship publications in the scientific literature. I think there's a lot of momentum to build the regulations, to build technologies, and raise awareness around indoor air quality. Thank you very much.
Thank you so much, Sotirios. And yes, I really appreciate the fact that you brought into the picture that some people in lower income countries, they suffer from air pollution. What I have found is that in low income countries or places, air pollution is more extended. Like you will find the same air pollution inside and outside. And then in the more
You've gone on mute, Sotirios.
Oh, I'm so sorry. I was
Yes.
just thanking
Yes.
Professor Sotirios about his input and the importance of bringing into the matter those low-income neighborhood societies or countries that they suffer from air pollution, and we also have to cater around their needs as well. That's all for today. We don't have, unfortunately, time for questions. I see that the chat is firing with the help of Claudia. I hope most of the questions have been answered. Thank you again, everyone, for joining this session. We have another session with different speakers this afternoon at 4 p.m. Central European Time. You are again welcome to join us. The main information at the beginning is going to be the same. We are just going to have different speakers. Once more, thank you so much for your time. I think those extra 10 minutes worth our time because we had the chance to hear some brilliant people from around the world sharing their knowledge around indoor air quality. Thank you so much again, and I hope to see you soon.
Thank you. Bye.
Thank you.
Bye.
See you soon. Bye-bye.
Bye. Thank you.
Take care, everyone. Bye bye.